Holcomb in the Indiana State Department of Health rolls out phase 2 of opening the state. Public data from the Institute for Health Metrics and Evaluation at the University of Washington forecasts the U.S. will see nearly 135,000 deaths by the beginning of August.
They revised at the beginning of April their model, and they said that there would only be around 100,000 deaths, and then now they've raised that number back up.
IHME based their data around changes in mobility as parts of the country begin loosening up restrictions. The model projects more than 6,000 Hoosiers will die of COVID-19 by August.
6,000 people is a lot of people, so it's definitely more people than what we would want to die, but it's less than 1% of the entire population of the state.
But these numbers are projections, or as Regenstrief Institute's Director of Public Health Informatics, Dr. Brian Dixon, likes to call them, guesstimates.
They may not get that high. Oftentimes when we make estimates about cases or deaths, there's what we call a confidence interval around that. So the number could be a little bit higher than the forecast, or it could actually end up being a little lower than the forecast.
Dixon has seen models that show 10,000 Hoosiers dying from COVID-19 by August. He says projections 2 weeks out are more accurate compared to months.
If, for example, we can get it to the point where we only have a handful of new cases every day, then we can identify those people and isolate them to try to limit the spread of the disease to new people.
He says the number of deaths will boil down to how well Hoosiers follow the guidelines to get Indiana back on track.
If we continue to practice social distancing, we kind of follow the guidelines throughout the summer, we may see that number actually be lower than 6,000.
Reporting for CBS 4 News, I'm Aaron King.